I'm Dr. Pri, and this is the Longevity Now podcast, where we distill insights from the frontier of longevity and preventive medicine to help anyone live healthier for longer. Today, we're going to talk about this Reddit post in the Peter Attia Reddit. 57-year-old female laid out some of their biomarker levels, wanting to know about dementia prevention. Now, I'm going to read between the lines here and assume this means Alzheimer's dementia. It's virtually always the case when people are talking about dementia. This is 80% of dementia cases, but there are a few others. Features of dementia are memory loss. Sometimes it's you're losing recent memory, sometimes you're losing past memory, and then usually progresses to some kind of behavioral changes. Some people get more aggressive. Some people are less able to do their executive function, like do their taxes, manage day-to-day things. Obviously, a horrible set of diseases, and Alzheimer's is the main one that we're trying to avoid. So I'll answer this person's question. We're not going to go through all their biomarkers here. I think it'll be more instructive to first start with what are the features? What do we do to prevent dementia? And I got a snazzy little one-pager here that I'm going to go through. Before diving into this, I think we should level set as to what is the risk of dementia in general. In the US, there is a 10 to 15% chance that you will have dementia by age 85. That also means there's an 85 to 90% chance that you will not have dementia by age 85. But that's kind of the baseline risk. 85 is pretty old. Most people think, oh, if I get to 85, that's pretty solid. 72 is the average age these days, average lifespan. So it's significantly above that. So there is a risk, and I want us to level set there. The first thing I want to go to is this bottom right corner, non-modifiable risk factors. There's two. One is head injury. So prior significant trauma increases risk. I don't think we've really quantified that. A lot of this is related to sports, could be a car crash, but that increases your risk of dementia. And then your ApoE genetics. This one we have a lot of quantification on. ApoE is a gene that relates to cholesterol, which we'll talk about as being a major factor for preventing dementia. And you have three options as to what you'll get, and you get two copies. There's the ApoE2, ApoE3, and ApoE4. 3 is your standard. You have two copies of ApoE3, you have that regular risk of Alzheimer's dementia. 2 is protective. You have a much lower risk. If you have two ApoE2s, then you have a 1 to 2% chance of dementia at age 85, significantly less than the standard. If you have one ApoE2 gene, so you get a 2 and a 3, then you got about half the risk, 4 to 8% by 85. If you have an ApoE4 gene, now you have 2 to 3 times the risk, call it 25 to 30% chance. If you have two ApoE4 genes, you have much higher risk, 50 to 60% chance of getting Alzheimer's by 85. Then there's a few people. 1% of the people who get Alzheimer's have a gene that virtually guarantees that they'll get Alzheimer's. But we're not going to talk about that today. We're going to talk about the 99%, the most common cases here today. How do you prevent Alzheimer's? I had another video talking about p-tau 217, early detection. If that's positive or rising, what do you even do about it? I'm going to give you my mental framework for thinking about this. This is not 100% accurate, okay? I'm not claiming that it is, but I think it's a good way to think about it. So when you look at all the risk factors that we have really good evidence around for Alzheimer's, they all relate to your blood vessels, cardiovascular health, things that we know from good randomized controlled trials that reduce Alzheimer's risk, lowering your cholesterol, not having diabetes or lowering your insulin resistance, having normal blood pressure, not having an inflammatory disease, or at least managing that autoimmune inflammatory disease. Okay, then lifestyle factors, going through the left column here, smoking cigarettes, drinking alcohol, more exercise helps, better diet helps, quality sleep helps. And when you look into the dietary factors, it's dietary factors that tend to relate to inflammation. For example, omega-3 fatty acids, those lower inflammation. They're better for your blood vessels. If we're using this paradigm that blood vessel health is the key to having better, lower rates of Alzheimer's, I'll offer you a way to think about this, a metaphor. If you think about Alzheimer's as a buildup of these protein waste products in certain parts of your brain, which is how we used to diagnose this and what we see, amyloid plaques and tau tangles are what they're called. Well, why are those not getting cleared? And why is the clearing process worse and worse as we get older and worse in certain people? I want you to think of your bloodstream, your vasculature as roads. So you got big ones like highways, superhighway, your aorta, then you got smaller ones that are big streets. And then you have the little ones that are like maybe your street right outside your house, small little street. If those little streets get damaged, they can't clear trash out. Nutrients can't get in either. And over time, you get a buildup of trash. That doesn't happen in modern day, but you can imagine that happening. And that's exactly what I think is happening in your brain. Happens in other places too, but your brain is particularly susceptible to this. And eventually, that leads to problems that we see in dementia, which is why we are focused on vascular health, cholesterol, diabetes, high blood pressure, inflammatory diseases, and these other lifestyle factors that contribute to vascular health. By the way, if you've seen my video on why we care so much about cholesterol, the 4 factors of heart disease, I'm going to harp on these factors over and over and over again. There's a lot of different ways to attack them. There's medications, there's lifestyle. We're going to get better and better at this, but these are the common pathways, the common enemies that are going to account for a lot of chronic disease. These days, if you're listening to this in the future, I'm sure you can go back and read about it. You're going to hear a lot about Ozempic, these GLP-1 agonists, and you'll hear people saying, wow, it's crazy because they are helping with these diseases beyond people losing weight. Well, that's right, because you can be a normal weight and still have insulin resistance or diabetes. You can be a normal weight and still have high cholesterol. All of these are intertwined. And so the good thing is you kind of have one target for staying healthy. The bad thing is it's a tough target and we have to really hammer at it, and it gets tougher as time goes on, which is why we want to start early. I'll get off my longevity soapbox now. Some really interesting factors here on the top right. Modifiable risk factors where we have emerging evidence. So we don't have great evidence for these, but it makes sense mechanistically, and we're getting some pretty good evidence. One of the coolest ones, I think, is sauna. Get you a reason to get a sauna and to get into it. 3 sessions a week, 20 minutes each. Some couple good Finnish studies showed that reduced Alzheimer's dementia rates by 50% in the people who were using sauna that way. Stress reduction. We do not have great ways of measuring stress, but people who are subjectively less stressed have lower dementia rates, likely mediated by inflammation. Same with the sauna, by the way. Cognitive activity. This one, I'm not sure exactly how it works, but people who have hearing loss or just are not cognitively stimulated as they age, that also leads to more rates of dementia. So let's bring it back to our friend here over on Reddit. Their cholesterol was a little bit high for my liking. I like that ApoB to be right around 60. I would certainly try to lower that 100%. They ask a few questions here. Would they pay out of pocket for a coronary calcium score, CAC? Yeah, it's not that expensive. I can tell you if you have existing current atherosclerosis disease there. In their situation, would they treat based on ApoB or LDL alone? If you want to lower your chance of having dementia, yes, I would treat. Any obvious diet modifications for ApoB, LDL that don't require a full diet overall? Number one factor for me is add fiber. Get 50 grams of fiber a day. You're currently at 7. Triple that. That'll help a lot. I don't know if you would count that as a full diet overhaul. I personally wouldn't. Indian, I like beans and lentils. So maybe I'm just different in that way. But I hope that's helpful. Those are the main things I would do. And then make sure you're not having any insulin resistance or anything else like that.